Ethical dilemma questions can sometimes be the hardest to answer in your MMI interviews because often there's no right answer to give. So in this video, I'll be sharing with you my general strategy for answering ethical dilemma questions, as well as answering a full MMI scenario myself. Hey everyone, if you're new here, I'm Emil and I'm a first year medical student studying at Monash University in Melbourne, Australia. And without further ado, I'll get straight onto the first part of this video, which will be my general strategy for answering ethical dilemma questions in MMIs. Often ethical dilemma questions will give you a really difficult, challenging scenario where there are multiple factors to consider. So the first part of my general strategy for answering these questions is to consider as many sides as possible. The reason I think this is really important is that in many ethical dilemma questions, there'll be several factors that you're expected to consider, and there won't necessarily be one right answer. So as a result, considering all of those other issues and taking them into account when you're actually giving your answer is what will set you apart from most candidates. The second step that I usually take when answering ethical dilemma questions is to actually pick a side. So with a lot of ethical dilemma questions, you will be required to make a decision of some sort, even though it might be very difficult. It's important to make this decision so that you don't seem indecisive, because in the real world, doctors will have to make difficult ethical decisions and they can't just decide to sit on the fence, they have to choose to make an action. Furthermore, it's good to note that in some questions there will be one side that is significantly better than the other. So you should also know that not all ethical dilemma questions will be really grey or uncertain. Some of them will be black and white, and there might actually be a right answer or a right side that you should pick. This concept especially applies to those questions where there might be plagiarism, alcohol consumption, or consumption of illicit substances, or something that would really seriously breach the ethical practice in medicine. Now, these two steps make up the majority of the backbone of your answer to any ethical dilemma question, but after doing this, I like to ask myself a few questions as well, just to make sure that I cover all of the bases in a scenario. The first of these questions is, what things would I not want to happen in this scenario? I think this is a really good question to ask yourself because it makes you think of the worst case scenario, and you can actually explain this to the interviewer as something that you really wouldn't want to happen in a scenario, and that you'll be avoiding that at all costs. By telling the interviewer this, you highlight your ethical skills and your consideration of all the factors in the scenario, and it's a really good way to set yourself apart. Another question I would ask myself is, how would certain individual parties feel in each of these situations? So especially when you have scenarios that might have multiple parties involved, sometimes it might be a doctor and a patient, sometimes it might be three members of a team trying to work together. It's really important to consider how every single person in the scenario would feel. Asking yourself this question means that you can address every person in the scenario, even if it's quite brief, just to make sure that you cover all of your bases and it doesn't seem like you've left some massive gap because you weren't sure how to address it. Finally, after asking myself all of these questions, I think I would be really confident to answering any ethical dilemma question because I'd have considered all of the factors in the scenario, I'd have considered all the stakeholders, and I would have a strong point of view that I would like to give across to the interviewer so that I seem really confident. So now that we've gone through my general strategy, what I'll do now is I'll try to illustrate these strategies through an example where I go through a full mock ethical dilemma scenario. The scenario that I'll be going through today will be scenario 47 from my free MMI book. So perhaps before watching me go through this scenario, go to the link in the description down below, download that MMI book and have a go at the scenario yourself before you watch me answer it. So in this scenario, you're working as an intern in a busy hospital, and on your break in the public hospital food court, you notice two senior doctors talking loudly about some of the patients you have been treating. You know that doctors are not supposed to discuss patient matters in public areas, and that there may be people in the food court who overhear the conversation. You do not know if the doctors have disclosed any sensitive information. The first question in this scenario is, what would you do in this situation? As you can see, this is a very clear ethical dilemma question because there are two senior doctors to you who may possibly be breaking patient confidentiality, and you have to decide what you do in this situation. So my answer to this question would go something like this. In this situation, there are a few actions that I would take to try and deal with the situation as quickly as possible. So the first thing that I would do would be to politely approach the two senior doctors and ask to speak to them in a private location. The first reason I want to do this is because I don't want to approach the doctors in the public food court, because there may be people listening in and I wouldn't want to cause a scene in case the doctors got defensive or if an argument ensued, which even though I wouldn't want that to happen in the first place. Now, once I talked to the doctors in private, I would probably first ask them what they had been talking about, and I would suggest to them that I had heard them possibly discussing a patient's details that would possibly be required to be kept confidential, and as a result, I would raise that question to them whether they had been discussing confidential matters of a patient's details. And from asking them that question, hopefully the doctors would tell me either that they had been and that they were sorry, or that they realized the error in their own ways, or maybe they'd say that they had been and they didn't realize the issue with that, or maybe they said that they hadn't actually been discussing patient matters and with requirement of confidentiality. And so in that third case, I wouldn't have to do anything. I'd apologize to the doctors for, wasting their time or having to take them aside. And I would encourage them to just be careful with discussing patient matters, because it could be considered that they were disclosing confidential information. However, in the first two scenarios where the doctors would be actually discussing patient confidential information, I would make sure to tell them that if they could possibly reduce their discussion of those confidential matters in the public food court, as I had overheard them, and that might possibly mean that other patients or other people in the food court might have heard the information that they were discussing. So hopefully by taking those steps, the doctors would stop discussing that confidential information in the food court, and the patient's confidential information would be protected, and the doctors might realize the mistake that they had made in the situation. With that answer, hopefully you can see that I've really thought about all of the people involved in that situation. So firstly, I thought about the two doctors, taking them to a private location. Firstly, so that the people in the food court wouldn't actually be disturbed by the discussion we were having. And then I also thought about the patient's confidentiality and that their information should not be disclosed to people without their permission. And then thirdly, I thought about the doctors by actually taking them to a public location a private location, so that they wouldn't actually be embarrassed by the situation. Perhaps to take my answer to the next level, I could have also discussed what would have happened if the doctors hadn't listened to what I was saying, and whether I would give a formal complaint to the hospital or try to do something immediately in that situation to stop the issue from occurring. So the second question in this scenario is, why is the confidentiality of patient information important? With this question, I want to give several reasons as to why patient information is really important to keep confidential, and explain each of them with a decent explanation for the interviewer. So my answer to this question will go something like this. I think that the confidentiality of patient information is important for several reasons. Firstly, the disclosure of patient information without their consent can actually result in a direct risk to their safety. So when patients divulge their personal information to doctors, they might tell them their address, their age, their date of birth, and as a result, a patient discussing this information with a doctor, and a doctor breaching their confidentiality and leaking that information could result in the patient being targeted by all sorts of scams, attacks, and unnecessary issues. Then secondly, patient confidentiality is extremely important because it holds up the trust that is held up within the healthcare system. So when patients tell doctors their really important medical information, including their age, date of birth, family history, family medical conditions, it's really important that when they tell the doctors this information, that they trust that the doctor will keep this information for themselves and only for the treatment of the patient. If this information is somehow broken and this trust is broken, then the whole trust in the healthcare system is broken down, because the individual patient will feel really betrayed by their doctor, because they'll feel as though their doctor disclosed their information without caring about their own safety and about their wishes. And other patients who hear this information being divulged might also feel like their information might be getting spread around by doctors, by their own doctors, and as a result, they might lose the trust that they have in the healthcare system. And the consequences of this are fairly severe because it is that trust in the healthcare system that means that patients are willing to divulge their information to doctors, and it's with this information that doctors actually treat patients in the first place. So without protecting the confidentiality of patient information, the whole practice of medicine becomes much more difficult to do. So with that answer, you can see that I gave 2 reasons as to why patient confidentiality is really important, and I explained why each of those reasons had any significance at all, and I explained the cost to the healthcare system if confidentiality was broken. So the third question in this scenario is, does it matter if a patient's information is leaked if the patient never realizes? I would answer this question something like this. I believe that it does not matter if a patient realizes or doesn't realize whether their confidential information is leaked, as there are negative consequences of this regardless of whether the patient realizes. Firstly, the first negative consequence that actually occurs from a patient's information being leaked is that the patient's and doctor-patient trust in the healthcare system is definitely damaged. So even if the patient doesn't realize that the healthcare information is breached, other patients might see that the patient's confidential information is being leaked, and as a result, they may lose trust in the healthcare system. So as I previously mentioned, this trust relationship is so important between patients and doctors because patients trust doctors with their sensitive information, and doctors use that information to make a diagnosis and give treatment plans to patients. So if that trust relationship between patients and doctors is actually broken, then there will be a very difficult circumstance where patients might not be willing to disclose their information to doctors, and as a result, doctors might not be able to treat patients. However, I also do think that there is a second reason as to why it is important not to disclose patient information, even if the patient doesn't realize, because firstly, disclosing that patient information will result in other people gaining access to it, and these people could be people with malicious intent and who will now have extra information with which they can target a patient who might be particularly vulnerable. Especially since patients tell doctors about their most sensitive issues, it's really important that this information is protected because, for example, if there was a patient struggling with a mental illness, for example, they could be targeted by scammers or malicious people with malicious intent to actually target that aspect of their medical condition and to actually target that to either make money or exploit a patient's weakness. So for these reasons, I think that it's really important that a doctor never breaches patient confidentiality, even if they think that it doesn't matter because the patient won't realize. That question is very similar to the second one, but I again frame it in a different way, and I give several reasons as to why it's important that confidentiality isn't breached, and I relate it to the fact that it doesn't matter about whether the patient realizes it or not. The fourth question here is, how would you go about raising your concerns to someone who has power over you? So my answer to this question would go something like this. Although raising concerns to people who have power over you can be really difficult, I think that it's really important to do so, and I have a few strategies in place that I would use to counteract this pressure. The first thing that I would do would be to firstly make sure to clarify the details of any complaint that I wanted to make and make it as clear as possible and present it in a very understandable way. When approaching my seniors, I would make sure that it's really important that they understand what complaint is being made and that the complaint is actually justified in what is being said. I wouldn't want to approach my seniors with a complaint that is somewhat vague and undirected, and I also would want the complaint to be justified because I am in that position that is a lower power than the person above me, and as a result, it would be really important that all of the things that I bring up are really justified and reasonable. The second thing that I would do is I would possibly contact someone else to help me to approach the senior. So this could be someone of the same rank in power as the senior officer, or it might be a support system put in place within the hospital to raise complaints about people who might be in positions of power. By doing this, I would make sure that I am not personally hugely implicated by possibly bringing up this complaint, and that the senior might be more likely to listen to one of their peers rather than someone who they might consider to be below them in terms of power. Then finally, something that I might also consider doing is just approaching the senior person in a very private setting and explaining to them my concerns in a very non-judgmental way. And I hope that by doing this, the senior would be really open to feedback, more so than if I was really accusatory and really judgmental. And by doing so, I would hope that the senior would be more likely to listen to any complaints that I brought up. And I might even produce some solutions to apply to the scenario in the first place before even coming to the senior with the complaint, so that it doesn't seem like I'm just pointing out negatives and that I have solutions as well for the situation that I brought up. So those are some of the ways that I would approach bringing up a complaint to someone senior to me. With that question, again, I'm considering everyone in the situation, both myself, and I'm also considering some other options that I could use to bring up my concerns to a senior doctor or someone senior to me. The final question in this scenario is, what systems should be in place at hospitals for raising concerns about potential breaches of conduct? So this is my answer to this question. I think that there are several systems that could be put in place to report breaches of conduct in hospitals. The first of these that I think would be very useful would be an anonymous complaints register for staff. If staff were watching doctors practice and they notice some breaches of conduct, they may be afraid to actually bring up these issues with the doctors because they might be afraid of losing their job or afraid of bringing up these issues with someone who has a position of power over them, like in this scenario. As a result, having an anonymous complaints register could be very useful so that people can submit complaints about personal doctors, and these complaints are able to be addressed independently by either the doctor or by the hospital board, so that these complaints are taken seriously and that doctors understand when complaints are being made against them. Then secondly, a similar thing can be put in place except for patients. So an anonymous review system for patients can be made for doctors, so that patients who feel like doctors aren't treating them properly or feel like doctors are breaching conduct can actually report this to the hospital through a systematic way. Having these anonymous complaint system again can mean that the patient feels safe in that the doctor will not have any idea of who reported to them, and that they will be able to treat their patients as normal. And also the patient will be able to feel more comfortable in saying what they truly believe, because they won't be as worried about accusing a doctor directly and possibly hurting their feelings. Then finally, a very powerful strategy that can be implemented to stop breaches of conduct is an independent inquiry. So in Australia, there are several health boards such as AHPRA that can review and independently review hospitals. So if there are breaches of conduct occurring at several levels of a hospital, then an independent inquiry can be conducted to analyze whether these breaches of conduct are serious, whether they're occurring, and also to provide recommendations for a hospital to improve their systems and to reduce the breaches of conduct that might be occurring. So as a result, those are three of the things that can be done to reduce breaches of conduct within hospitals. So with that question, hopefully you can see that it was good that I gave several examples of things that could be done to review and submit complaints against breaches of conduct. And it was also good that I explained each of those. As always, remember with these answers that I am kind of under pressure here because I'm speaking to a camera and there's no one that I'm speaking to. So even though these might be considered good answers, they aren't by any means perfect. So do take them with a grain of salt. If you found these answers helpful, do check out this video where I go through how I answer personal questions, and make sure to subscribe to the channel and drop a like on the video.